Hi, I'm Virginia, and this is the Health Creators Podcast, where we talk about the impact and business of being a health creator. And here with me today is Dr. Azmain. Thank you for being here.
Whoop.
I should have
This is
given
a
the
good
audience
start,
warning.
isn't it?
Yes, it is. All right.
What? This is what health creators get up to after hours.
I should have called it Health Creators After Hours. That would have been
That would have been brilliant,
retitling.
wouldn't it?
Yeah.
Oh god. So you had some questions to ask me, didn't you?
I did. That is, yes. I mean, we could do 30 minutes of laughter, but I mean,
That's evolved pretty quickly, let's be fair.
So who are you and what do you do?
Who am I and what do I do? So, I'm Dr. Azmain. Dr. Azmain's Medical Quizzes. That seems to be my theme tune now. So, gosh, where do I start with my life story? I think probably the easiest place to start is graduating medical school in 2020 in the height of the pandemic. Taking a little step back for my health and well-being and starting on content creation because like I'd always wanted to create YouTube videos and I've always been that kind of creative type. So, and I loved like medical education throughout university. I just thought it was really, really cool and I wanted to implement it as part of my future career. So when I saw all of this misinformation, especially around COVID on social media and in general as well, like nutrition and all sorts of other topics, and seeing some of my fellow health creators starting to create during that time and just being super inspired by them, I was like, I want to do this too. I can do it. I've got the skills to do it and I've got the medical expertise to do it. And you know, I'm a junior doctor. I'm not a consultant, but I think the key thing is that I still do have a medical degree behind me. I'm doing a master's in medical education. You don't have to be an expert to teach someone. And just, you know, through creating my videos on YouTube, Instagram, TikTok, and networking through LinkedIn and other events, it's just gotten me the most amazing opportunities. The fact that I'm working with YouTube Health, the World Health Organization, collaborations with UNICEF, Rotary International, and a whole load of other global charities on kind of outreach work, public and global health. This is genuinely the stuff of my dreams that I'm living right now. And, you know, if there are creators or aspiring creators out there among all the healthcare professionals watching, I cannot recommend it enough.
Amazing. So likewise, I think everything that you've been creating has been so inspirational and you've kind of just gone from, you know, trying to get through medical school to building a massive audience that looks forward to all of the content you create. So how does that feel?
It's a bit mad, isn't it? I mean, because I have like 400,000 across my channels at the moment. You know, sometimes it's up, sometimes it's down because priorities change. Sometimes I can't be focusing just on the content. I have to be focusing on the other events or my charity or my entrepreneurial endeavors. So it's difficult to keep all of it up at the same time. But nevertheless, it is the social media and all of my videos going viral that led to all of these opportunities. So for that, I am forever thankful. In terms of how it feels to have so many followers, I still don't really know. Just to imagine 400,000 people in front of me, that's ridiculous. And the fact that my videos get seen by upwards of 100,000 people, just I can't even begin to imagine the kind of impact that it's having. The whole reason we went into healthcare in the first place is to have basically like a positive impact on the world before we leave it. Because, you know, if I wanted to make money, I'd have become a banker. like, like, come on. Like, you know, like all of us, we're clever enough to have gone into better paying jobs. But like, when it comes to job satisfaction and stuff, um, it's hard. It's hard being a doctor. It's hard juggling as many things as I'm doing. But would I say that I regret it? No, I don't think so. So, how does it feel? It's, sometimes you feel kind of numb. You feel like you're going through the motions when things are tough. And then sometimes people contact you, or you read some of your comments, or you go to an event and you meet people who have watched your videos and follow you, or just say that they've been benefited or impacted by my content. I don't have words to describe what that means.
I can imagine. I think it also gives you validation for all of the kind of effort that you've put in, because I think
Mm,
sometimes, and correct me if I'm wrong, but when you're creating something, you never know what's going to happen after you press publish. And I think
so
once you
true.
get into the motion of
Yeah,
pressing
yeah.
publish multiple times, you realize that the impact is going to be much bigger than you can imagine.
Exactly. This is what I love about having a community of clinician creators, because just being a creator in general, it can be a very lonely process. Like, and especially we're in a very specific niche when it comes to health, and we're kind of the pioneers of this space. It's only grown in the past few years to the extent that it has. And I'm part of creator communities in a broader sense, and we talk about all the kind of difficulties and struggles that we face, and how to um, jump over those hurdles, being on camera, um, promoting yourself, doing brand deals and sponsorships. But all of those are a lot more difficult when you're a healthcare professional. You can't just say yes to every like brand deal that comes into your inbox. You can't often just take out your phone and talk about a current news topic if you haven't thoroughly researched that beforehand. So that's the difficult thing, but that's the kind of standards we have to hold for ourselves. But the fact that I'm out here creating health content, reaching millions of people, and making friends with the most amazing, inspiring people would not change it for the world.
Ah, it's worth the risk. It's worth putting your neck
Yeah.
out there until someone from the regulatory authorities comes along and is like, "You shouldn't have done that." I mean, someone has to do it, and
Yeah.
it's better that it's a healthcare professional, because they have to be responsible with the health content that you create. And so what is your process to create health videos? And how's that changed over time? So where did you
Oh,
start and where are you now?
so when I first started, I've got a story. Um, the very first proper YouTube video I made. So I'd gone back to work, and then I posted a couple of videos as an experiment. Like, I posted a music cover. My channel was originally for music, and then I was like, nah, let's make this medical, because that's what my USP is. Um, Having said that, I'm looking to get back into medical musical parodies, so watch this space.
Drum
Um,
set in the background ready.
yeah, you bet. There's a couple of guitars, violin, keyboard hidden there, tambourine somewhere, cello and sax downstairs. I digress.
Could you do
Um,
them all at the same time? Is it one of those walking
one man
bands?
band, literally. So that was kind of the start, and that's where my YouTube journey started, like 10 years ago. Not 10 years ago, 14 years ago, when I first started posting music covers on YouTube. But my first proper medical video was on cardiac arrest. And I sent it to one of my absolute favorite creators on the platform, Medlife Crisis, aka Dr. Rohin Francis. Um, consultant cardiologist and a part-time comedian. So he is a massive inspiration for me. So I sent my first video to him. He didn't reply to my DMs. I was devastated. But now, like, we always chat to each other in the DMs, and it's so nice to be friends with the people that inspired me to start creating content in the first place.
Oh, that's such a beautiful story. So, how did you go from doing music covers, and how has your equipment changed over time? Because I think a lot of people have kind of worries that their equipment, their lighting, their camera, none of it is ever good enough, their microphone. How did you kind of put those pieces together? What were your building blocks?
My building block was this. This is the only
Mhm.
building block I needed. Smartphone. Everyone has a smartphone nowadays. That is literally all you need to create content. Your smartphone and your brain. That's it. I would say if you want to get started as a creator on social media, do not invest in anything more until you've created a good 5 or 10 videos with just this alone. That's as simple as I can put it. Then, as we progress, you can think about lighting. So lighting is important so people can see your face, people can react to you. I have about 4 lights just in front of me here. So I've got key light coming in, filling in this side of my face. I've got a fill light to cover the darkness on this side. I've got a hair light so that I can be differentiated from the background, and I haven't actually got my background lights on at the moment. So 3-point lighting system, that's kind of the next level up. Audio is really important. If people can't hear you properly, they're going to swipe off your video. They're not going to care. So the next thing to invest is like a microphone that can either plug into your phone or an external mic like this, something that can plug into your computer via USB, and then we can get into more complicated options. Then that's kind of the equipment side of things. So obviously you need the tripods, you need this, that, and the other to hold your cameras. I invested in 2 cameras only when I started doing my own podcast. You don't even need a camera these days if you want to create content. Genuinely, smartphone is good enough. And I would just say that equipment is the lowest barrier you should have to creating the content, right? Because you are not supposed to go and buy all these lights and cameras and stuff before you start creating content. It should be all about the content itself. And that brings me back to my process. Because once I've got all of this set up, I can think, how am I going to proceed with this? Idea. The idea is the main thing. Like, what do I want to make a video about? What is trending in the news? What is an important health topic that I want people to know about or that people are searching for? It's all about, raising awareness of certain health issues, depending on what you feel is most important, and most importantly, what the target audience thinks is important. So that's why I make content that explains current news topics in an easy to understand and jargon free way. And I try to make that as engaging and entertaining as possible. So when you've got the idea, you obviously research that thoroughly. Sometimes you need to be quick in that research process to be able to get videos out in a timely manner. But again, as health creators, that due diligence is something you just cannot skimp on. It's a necessity. When you've done the idea and research portion, then it comes to the scripting. I think scripting is really important, not just as a health creator, but as a creator in general. off the cuff content can do well on platforms like TikTok, which is really, you know, authentic and raw. But you have to be really careful when it comes to health content, because you can't really put a foot wrong when you're putting what is essentially authoritative health content in front of an audience of potentially millions. So you can't kind of just delete the video on the slide and be like, you didn't see that. So uh yeah, that's like really, really important. Um and when I do the scripting, I ensure that I have a very clear hook. There should be a reason that people watch. People get frustrated when they put videos on these social media platforms and then they blame the algorithm for not pushing it out to people. From what we can understand, you and me, of what we've learned of social media, is these platforms pull content to the audiences that they think um, are going to be most interested in them. Because at the end of the day, these social media platforms, all they care about is increasing their revenue. And the way they do that is by keeping people on the app. The way that we can leverage that is by making sure that they stay on the app by watching our videos instead of all the other crap and misinformation that's out there. So
Yeah.
that's our job, basically. And that means that if we script a video well and have a proper hook at the front of it to draw viewers in, then videos have a chance of going viral. Like on TikTok, my recent few videos, one on whooping cough, I started by coughing,
Oh
like
god.
like doing the hoop, and people like, you know, this is wait, what is going on here? It stops the scroll, right? And it has some like 1 million followers right here. And
Wow.
then the follow up has like 87K. And then another one up here on like a cryptosporidium outbreak has some 375,000 views. So it's the videos that I plan to become viral tend to go viral, because I know this is a topic within the zeitgeist. It's a topic that people care about, and it's a topic that I can make people care about. When they hear that hook, they're like, whoa, I need to listen to this.
That's really interesting. So I like the idea of, even scripting the sounds that you make in your videos. So with video, you just have so many different senses that you can play
Yeah,
with. So you
yeah,
can make the music emotional, you can include sounds to get attention, you can also speak empathetically as you would, or energetically as
yeah,
Dr. Asman mostly does. So, but I think also it depends on who you're trying to reach at the end of the
yeah,
day. So
exactly.
if your audience enjoys very energetic videos, or if they want to watch something where that's a bit more serious, that's more
Mm.
calming, then I think that also opens up the doors for all kinds of creators as well. So your audience will find you ultimately, and so don't feel that you have to be like every other existing creator, because there's definitely no other Dr. Asmine out there.
Yeah,
So,
I think be true to yourself. Like, there is nothing, no advice that I can give better than that. If you're making videos on social media, you can be like a little bit of an exaggerated version of yourself, like I am, to get people's attention, and I find that that works. And it's not everyone's style of video, and it shouldn't be, because we all have our different styles, and people resonate with different things. And as long as it reaches the people who resonate with it and who will actually learn from it, then that's what matters most. Because in a clinic room, we can see a handful of patients, like sometimes single digits, sometimes double digits max in a day. But one video can reach hundreds of thousands of people, and the impact that can have is tremendous.
amazing. So what are your top tips for health creators who want to get started?
Um, just do it. In the words of Nike. So like,
Not
what?
sponsored.
Not sponsored. Hashtag not sponsored. This is not an
Not
ad.
bad.
Um, so he says while wearing Adidas trainers. No, no, they're Nike. Whoops, they are Nike.
I live in Pumas, just
um, the trackies are champion. Anyway, this is like becoming. Are you planning on getting this like sponsors? Because like I think like just this segment alone could get thousands of pounds. Like when we talk about monetization as creators. So monetization comes later, by the way, when you're a creator. The first and foremost thing is providing value to your viewer. You have to think about your why. What is your why? Why do you want to create on social media? Is it to, if you're a consultant, is it to market your private practice, or is it literally just, to build your personal brand, or just to help people just for the fun of it because you're a creative person? And there are so many amazing creative people in our community who just do it for the love of it. So explore what is your why. Next is, do not get bogged down by equipment. Smartphone is enough. Just good lighting, decent audio, film in a quiet room, and then learn to edit along the way. Don't aim for perfection in terms of the video quality, the editing quality. All those will come with time when you put the reps in. Do your due diligence when researching, because once you put something onto the internet, there is no taking it back. And connect with your fellow clinician creators, because there are a growing number of people in this space, and they are some of the most incredible and inspiring people I've had the pleasure of meeting. So you're not alone. Get out there, meet people like yourself, and go forth and create.
I love that. Likewise, inspirational. So, I guess one final question is, how do you handle the pressure to create? Because I think some people feel like it's hard to get started, but other people might feel it's difficult to keep going.
The perseverance is key. You have to realize that we are healthcare professionals. We're not just your standard influencer with a full-time job of creating content. We have to balance alongside everything else. So, give yourself the permission to slack off if need be. Like, you have other priorities. You have to look after your patients. You have to look after your family. I feel guilty when I go a week without creating content, but I think to myself, I am working myself so hard that I need to be fair on myself. I need to look after my own body. I need to spend time with my family. There are some things you can't neglect. And when you're growing an audience, the audience is still going to be there. They'll wait for you. But there's another point here to make, is that you don't own your audience on social media. So it's always best to build an email list and newsletter, take them off platforms so that you can directly reach out to them. But yeah, the pressure of putting a video out to hundreds of thousands, millions of people, you get more used to it, but the pressure doesn't really lessen. It is high stakes, and that's the nature of it. There's no changing that, really. But the whole reason that we want to do it is because it's high stakes, because the potential reward of a highly successful health awareness campaign is just, beyond anything that we can do within the four walls of a clinic. And that's why we do what we do.
Yeah, 100% agree. I think that you do need to still look after yourself as a creator, and creator guilt will always be there, but so will your audience. And
Yeah.
social media platforms are just rented space. So if there is something that you want to create in future, like a book or a stand-up session, then do keep that in mind when you start creating. Even from your very first video, you can give out something for free, maybe like, you know, a top tip sheet on how to sleep well or something like that, whatever your video is about. And then those emails are how you actually start to, you know, connect with your audience, because you can keep them engaged that way. And if something does happen to your YouTube channel, TikTok, Instagram, then at least you haven't been putting content out there, building an audience that you can never actually ever reach again. So word of caution there. And yeah, there's lots of potential to monetize. And if you're not sure what monetize means, it means to actually get an income, so to make money from your creative ventures. And sponsorship for this podcast, who knows?
Watch this space.
There may be some ethical implications there. But thank you for your time today, Dr. Azmain. It's been a really helpful and insightful chat, and it will be so interesting to get you on again in future to see what's changed and what's new.
It's been an absolute pleasure, and I'm glad it didn't completely devolve into chaos. But this has been so fun. Thank you so much for having me on, Virginia.
Thank you once again. And of course, I'll leave links to all of Dr. Azmain's creative ventures, so you can follow him, subscribe, link up with him, and watch all the amazing content that he puts out there. So thank you so much for watching or listening, and I'll see you at the next episode. Bye.
Bye.
I'll make something up.
It's already recording. Oh my god.
Right, I'll clip this bit.
It's okay. This can go in the outtakes at the end.
Literally.
They'll love it. They will love it. Oh
I'm so prepared.
Oh my gosh.
Are you okay?
I think I'm okay. This always happens. Okay.
It's good to start off laughing. It's a good vibes. Good vibes. All right. So, what do you want to do? I get. If you get, I don't know what you get with 2 thumbs up sometimes. Or, oh yeah, if you do the rocking thing, you should get something. I don't know how long it takes to like recognize. Is that the rocking thing? No, this is the rocking thing. This is the rocking thing. I don't know. We've got some great choices.
This is a serious podcast. We're professionals. We take things very, very seriously here. No laughing. No! Stop it, Virginia!
Who needs some sleep? It's been a long day. Yes, bulge those biceps.